Before I begin, as many of you know, before COVID, I was very active with mission work. My website is missiontocureblindness.com. In fact, before COVID, my wife and I were maybe doing 2 missions a month, and it was very, very rewarding. So just this past weekend, I got a phone call from site.org, which is a wonderful organization doing work in Africa, and they want me to be the medical director to help with their mission work and also help with teaching African doctors. So I'm going to be heading to Africa in October. First stop is going to be Madagascar, which is in the southeast portion of Africa. And we're meeting with the team there. We're going to gather some equipment, and then we're going to be taking all that to Togo, Africa, which is on the west coast. And that's where we're going to be setting up our operation in Togo. So this is just a wonderful opportunity for me to get back into the mission field, not only to do cataract surgery and help blind people, but also teach African doctors the technique so they can work and help their old people, their own people. So you can help me with my mission work. This is not a salaried position, and it is rather expensive to do the surgery, to pay for the equipment, etc. So we're looking for donations. You can go to site.org, that's the organization, and they are a 501c3. So any donation that you give will be 100% tax deductible. And every penny that I get will go towards mission work. All you have to do is click Give Site Today right here. You'll come to a donation page. And in the note, put down Dr. Kondrot's mission. And I would really appreciate that. And of course, I'll keep all of you posted on the mission work. And also want to let you know that in no way is this going to interfere with the care that I'm rendering you. We're still going to be doing the bi-monthly webinars. I'm still going to be doing my program. Thank goodness for technology that, we can be anywhere in the world and still communicate. So I'm going to stop sharing. And let's see, we're going to open it up for questions. We have someone here, a Zoom user.
Hello.
Yeah, hi.
Hi.
And who is this? I don't see your name.
It's Vivian Allers. I'm on my iPhone. Somehow it doesn't tell my name. But I have a question for a friend. She gets injections every few months in both eyes. She said she has floaters and she has fluid that leaks from her eyes, and the shots are supposed to control that. Is there, I talked to her about your work and your method, and I wondered if there is any alternative therapy that would help her not lose fluid and help the floaters without getting these injections.
Well, I'm not a big fan of the injections. I did a webinar on the dangers of injections, or the misinformation, the big lie with the injections. I mean, the injections may help the first couple of months, but studies have shown that long-term use of the injections, everybody that used the injections had lost vision. So the first step is I would like to take a look at her eye records. So if she could send me a copy of her eye records.
Yes, she is moving to Arizona in October, Apache Junction.
I know exactly where that is.
And she needs to find a new eye doctor. She's been in Montana.
Oh, well, I have a good doctor to recommend. Dr. Bruce Newman.
Bruce Newman.
Neuman. He's a friend of mine. When I practiced in Arizona, he used to cover my practice when I traveled. And he's open-minded to alternative therapies. He has my cell number, and he'll probably give me a call. But before you see Dr. Newman, I'd be happy to take a look at her records. Send me a call.
Okay. And he's in where in Arizona?
I think he's in Cave Creek.
Cave Creek?
Cave Creek, which is north of Phoenix.
Okay. Yeah, she's not far from Phoenix.
Well, that may be a drive for her. I mean, Phoenix.
Well, she can drive. She just drove from Montana to Michigan. We spent some time together, so she can drive.
There's a joke about Phoenix. You can drive 4 hours in any direction and still be in Phoenix. It's getting so big.
I have another question. I have the microcurrent machine. I wondered, she had a head injury in 2008 and lost quite a bit of function memory. And I wondered if the microcurrent brain balance program for females would help someone with a head injury.
Oh, definitely. Definitely. I would try that. And I think it's very safe to use. I don't think there'll be a problem.
Okay, I did let her try that one time, and my sense of her was she seemed extremely peaceful afterwards, and she said she felt relaxed, but she wasn't able to sleep very well that night. Is that possibly an effect of
it may have been too much energy going into her body. And also, anytime you get a side effect from the microcurrent, you always want to make sure you're properly hydrated.
Okay.
If she wasn't hydrated, that could have had a toxic reaction with her.
Yeah. Yeah. Sometimes she remembers to hydrate and other times not.
Now, where does she live?
She right now lives in Montana, but in October she's moving to Arizona.
Well, there's a lot of good alternative doctors in Arizona. There's the Arizona Homeopathic and Integrative Medical Association. These are all homeopathic doctors. I used to be the president of that group.
Tell me again, homeopathic?
The Arizona Homeopathic and Integrative Medical Association. It's a wonderful group of doctors that do alternative therapies.
Okay, because she needs a new doctor.
Now, these aren't eye doctors. These are just alternative.
They're regular doctors. Yeah, she has diabetes, is on insulin. And
definitely she should see one of those doctors.
Okay. Thank you for those good referrals.
Okay, thank you. Okay. We have Mirjana. How are you, Mirjana? You have to unmute yourself.
Yes, can you hear me?
Yep, I hear you. How are you doing?
I'm doing okay. Still
good.
Going over like beginners stuff. I'm using almost for 4 weeks machine, after microcurrent machine, and a little bit over 2 weeks I'm using homeopathic remedy, and similar times with the light therapy. I just got back results from urine challenge test, and I have some questions regarding that. Just to remind you, in 2000, I've done that test in 2016, and it was really, really bad. And actually, my practitioner said the worst he ever seen. So that was really a changing moment for me, because I eat organic, I live reasonably, but I start, like, since then, I basically cleaned up everything in my life. I kind of, they say, accepted detox life. So I have find ingredients best that I can, and basically, and I got sauna. I got like a IV ozone, which is also cleansing, because the chelation that chelation test, IV test, I've done really poorly. Everything was burning, so I decided I took out all my ceramic crowns they had the metal rings in it, so I replaced with non-metal. And I was really hoping this test will get out better, and it did in many aspects. But lead, which is the biggest problem, came really high, although half of what it was, and mercury also. So my first question is that provoking agent, where is that taking stuff from? From the tissues, from the bones, from the digestive system? Where is that stuff coming
It takes it where the lead is locked into the body, the fat, your muscle, anywhere that lead doesn't stay in your blood and your urine. It goes into your body. So these chelation.
So this test that I've done, like, because the thing that I am curious about, how much diet at that moment, for example, what I ate, like a first hour, no, but how much of that stuff is in that test result?
Probably very minimal, very minimal.
Yes, because I tried
unless you're eating very toxic food.
That's my question, because I'm so careful that I even changed, like I buy glasses like no lead.
Yeah, but it's unlikely that diet contributed to it. It's not unusual to take a long time to reduce the lead.
Yes.
I've been trying to reduce my lead for over 20 years, and I'm still doing chelation, and it's still there.
You know what? I went so far that I chose dark chocolate with less lead, cadmium, and arsenic, and I just realized that that's ridiculous. I stopped eating chocolate a few months ago, and I'm still struggling with coffee because coffee is full of that stuff. So, and I have coffee every day. So I'm rethinking, because there is not much wriggling space to reduce lead in my life. But my question is, do you, from your experience, have some unusual sources that you find in a patient of like lead that are not aware? Because
well, I'll tell you, one of the biggest sources is the air we breathe. You know, if you live in Los Angeles and all the auto exhaust and the fumes, and you know, it's in the air, and also in our home. Our homes sometimes are a toxic dump.
Yes, I live in California, that's true, and they use unleaded fuel for a long time, but in all my kale and vegetables.
No, but there's a misconception. Unleaded is just reduced lead. There's still lead in the fuel.
Okay, one less mystery. I have air filters in every room, especially bedroom, and I also have what worries me. I had that test. It recommends not to eat fish for 2 weeks and not to take supplements for 2 days. I kind of your recommendation didn't mention that, so I have a fish 3 times a week because I used to be vegan and I struggle with weight. So I need, but it's a 3-ounce piece, and that's the best fish I can find. So mercury is there. So what do I do? Like I'm kind of, I don't have much space to reduce pollutants in my life, and I don't want to become obsessed with it.
No, I think that you do need to be very careful with your diet, and you need some type of ongoing chelation treatment.
I made an appointment for Monday with my physician that is doing chelation, and I'll talk to him. But his IV chelation scared me. I'm guessing it takes out too much too fast. I had
no, there's different ways. You know, he can maybe do a full dose, a partial dose. There's different ways of doing it gently. IV's the best, but a skilled practitioner will do it best suited for you.
But how they prevent some of that, like staying in my kidneys, and you know how they clean? I'm worried about that part because cadmium, I know that damages kidneys. Because after first chelation, my mouth was burning. I had metal in my mouth. That was a big mistake. And somehow I have more mercury than before. And
well, you have to talk to your practitioner about that. I can't go into all the details about that right now. It sounds like your case is kind of complex.
But tell me, would you recommend, if I go one that you recommend, which is oral, or the other one I would like to, and for example, go for IV chelation once a month? Is that
generally what I recommend the IV once a week or twice a week is very expensive. What I recommend is you take a good oral agent every day, you do the rectal maybe every other day, and do an IV once a month.
I
That's
like
kind
this
of-
one for many reasons. Price one of that because it's $300.
Yeah, it's expensive. It's expensive, and one IV is not going to remove all the lead.
Yes, and right now I'm afraid that like it will take out too much, and I'll have some like a backlash and lots of lead in my system.
Well, if you're worried about it, don't get it done. But I think you need to be under the care. You're asking the wrong person for advice. You need to talk to a good, trained alternative doctor that can handle all the particulars about your situation.
You know, after they let me do chelation test, this urine test with the metal in my mouth, I like to do my own research and, you know, be informed. That's why I'm asking you. It's not that I don't trust him. It's just he's very busy and sometimes forgets to ask me right questions. So after that, I do my research and come prepared. That's the only reason.
Mhm.
And I don't know anybody else who is doing it. So Chris sent me two supplements for oral detox, and am I taking both or is it alternative?
I recommend you take both.
Or both? And they're like at
Half the
same
dose
time?
of both. These are two products that I discovered, and I'm evaluating both of them. I take a half a dose of both of them every day. I don't take a full dose.
Do you take them at the same time or throughout the day?
No, I divide it. I take it in the half a dose in the morning and then half a dose in the evening.
Okay, and if I want to take some binder, how would I, like I take chlorella, how would I space it with a binder?
That I can't, you know, we have a lot of other questions. I don't want you to monopolize all the time. I think send me an email with all your questions, but once again, if you're under the care of an alternative doctor, he has to be the captain of the ship, not me.
Okay, it's fair. I'm just trying
Too many chefs will ruin the soup.
Yes.
If you're under his care, you have to find somebody that you trust and you follow their advice.
Okay, I was just hoping to hear like what your experience, feedback from the patients, and maybe I some of that advice.
Now, once again, my recommendation is the following. I like the oral agent every day, the rectal every other day or 3 times a week, and maybe IV once a month if you can afford it. That's kind of like my protocol that I recommend for patients.
Okay, that's something that actually sounds good to me too, and I really appreciate your time that you.
Okay, well, keep us posted, okay?
Okay, I will. Thank you.
Okay, we have a question here from Marie. She put 2 drops of Aquamed into her eyes before microcurrent. Can I put 1 drop into my eyes in the morning? Yep, you can. You can use the Aquamed twice a day. And if that's a good idea, put 2 drops in before you do the microcurrent, because the microcurrent acts as a carrier. By that, I mean, it'll help take those ingredients into the eye. The Aquamed drops has ascorbic acid and glutathione precursors. And these are the substances that were found to be reduced in the aqueous humor, which surrounds the lens of the eye. So that, I think, is a good approach. And I think maybe it'll be a little bit more effective for you when you do that. All right, we have the Zoom user. I think you have another question. Hello?
Where do you place the gloves with your microcurrent machine for the lead program? And what does that lead program do?
Okay, well, first of all, the microcurrent helps improve the detoxification of the body. It isn't really specific for lead. So if you're saying it's a lead program, it's not a lead program. It's to stimulate all the organs of detoxification, which your kidney and your liver, mainly the kidney. So it helps the secretion of the kidney.
And where do you place the gloves?
Well, there's two categories of programs. One is the body programs. The body programs, you can either hold a glove in one hand and the other, and that's how you can do a detox. Probably more effective would be to place one glove over your abdomen and the other one on your back.
Where on the abdomen? Below the belly button, or
I
does
did
it
make
matter?
a video. I have an in-depth video on glove placements. I would highly recommend
Okay.
you watch that video. I talk about glove placements for all the treatments.
Is that a podcast?
It's a webinar. You can get that from Chris.
Okay, thank you.
Email info@healingtheeye and we'll send that to you. But we have all of you that are in the home program, there's about 5 videos that you need to watch. How to do the light therapy, microcurrent, and I just made the one on glove placement because a lot of you had questions about glove placement, and also it goes into detail about using the pads. I like the pads. I had some interesting experience. I'm visiting my wife's friend in Montreal. We spent the week in Montreal, and she's a nurse, and she had severe shoulder problems, and she's been going to an acupuncturist, and the acupuncture helped maybe the first couple of treatments, but it hasn't helped. I did one microcurrent treatment on her shoulder, and she loved it. Pain completely went away. I made her a believer of microcurrent. And the sad thing is she's a nurse and she never heard of microcurrent. So now she bought a machine and she just loves it.
Is that the anti-inflammatory program?
I did the inflammation program. I didn't have the shoulder program on my machine, but I'll tell you, the inflammation program takes care of probably 80 to 90% of problems.
Yes, I use it all the time. I'm a dancer.
Mhm.
Never have pain that lasts at all after I hit the microcurrent on the joint.
Good.
That's
It works.
wonderful.
It works. Well, you know what? If it works on your muscles, it certainly works on your eyes. It's the same principle. It's improving reducing inflammation, stimulating healing. It's just a
Yes,
wonderful treatment.
wonderful. Thank you.
Okay, thank you. Okay, Sheila, your hand was up. Is Sheila there? Sheila, did you have a question?
Unmute. Yes, I'm sorry. I'm having trouble. I unmuted. Am I unmuted?
Yep, I can hear you. Yeah, how
Oh,
are
very
you?
good. Oh, I'm fine. I'm fine. Other than, some other things that I think I'm going to be getting information for you on my homeopathic, I do have a question. My eye is getting better, and at least I feel like it is. I don't think I'm telling myself something that isn't true. It just seems to be getting lighter, with the kind of problem I have with it. It's still blurry.
We have some background noise. Is there a plane in the background?
Oh, there's a helicopter going overhead, and it just started right now. I'm sorry, I don't know what to do about it.
Well, let's hope it passes. That's okay. When I'm in West Newton, Pennsylvania, there's a train that runs by. So anytime I'm doing a meeting in Pennsylvania, you hear the train. So
yeah. Oh goodness. Well, I'm noticing that my vision is lightening. It's not as dark, and I'm just wondering, is that kind of the progression? It progresses through doing that, or is it different with everyone?
well, it's different for everyone. And the microcurrent is causing changes in the anatomy. It's improving circulation, reducing inflammation. So you will have some subtle changes, either lightening or darkening. But of course, we always like to hear that your acuity is getting better. You're seeing things better. Things are sharper.
Yes. Well, they seem to be, it's not sharp yet, but it feels like it's getting to a point where it's going to be much better. I'm wondering if they're programmed when we're using them, if we need to have times between each treatment, like the light therapy and the microcurrent therapy. Should they be done separated from each other by a certain amount of time, um, like we do with the homeopathy and the vitamin things?
Oh, no, the microcurrent light therapy could be done back to back. But, everyone's different. Some people are sensitive and you have to listen to your body. If it feels like it's too much, then I would wait. It's probably best if you're doing the eye treatment is to do the microcurrent, maybe one time and then 6 hours later do the light.
Okay.
Separated by 6 hours. But
was
in
also-
terms of the other therapies, you could do the eye and then do the stress and do the detox. You can do those back to back.
Okay, so when we're doing those other therapies, inflammation, I guess I haven't done that one yet, detox and stress, which one is like inflammation and detox? They seem so similar to me. I'm a little confused about what the difference is as far as.
There's the big difference. Inflammation is reducing the inflammatory response. Let's say, I take a long walk or I injure my knee and there's inflammation or there's soreness. Inflammation will reduce that. The detox has nothing to do with inflammation. It's stimulating the body's mechanism of detoxifying, eliminating toxins.
Okay, so if I want something to do other than prayer, a recreative healing in a portion of my body, what program is best? I mean, all of them I know, but which one is the first focus?
Well, I would say that the first focus, if you want to stimulate healing in your body, I would say you want to do the stress or relaxation.
Okay.
Because remember, your body will not heal if you're in a sympathetic state or a stress state.
Okay, yes.
So deep breathing, meditation, prayer, anything to relax your body.
Okay.
So I like the stress program. A
Okay.
lot of times during the day, I don't know, for some reason, I feel stress. I don't know why. And, I'll do the stress program and just relax, take some deep breaths. So that may be a good program to start with.
Okay.
Because, if you're anxious and stressed, the eye treatment probably isn't going to help you.
Okay.
But if you're in a relaxed state, one of peace and calm, then the microcurrent eye treatment will be much, much more effective.
So it means stress first, then even to.
Yeah, reduce the stress first.
Okay. Just curious because I just have the one eye with a specific problem, but both with macular degeneration. Having that treatment over both eyes is the way I should be doing it, right?
Yes, we don't treat one eye.
I didn't-
Energetically, the eyes are linked together, so we're treating both eyes together.
Got it. Okay. It was just a thought that had come and I wondered. Okay. Yes, I thank you. And I've set up an appointment with Chris to hear back on the homeopathy.
Okay, great.
So,
Oh, remember, folks, I think there was a question at the last meeting that we should have these meetings more frequently. Well, now we have every Wednesday at 2:00 Eastern time. It's Ask Chris a Question. She's devoted 2 to 3, a Zoom call. You log on. It's very helpful. She can usually answer, a lot of these basic questions about glove placements and, things like that.
What day?
Every Wednesday at 2 p.m.
What Central Time?
Eastern time. And I'll
2
send
p.m.
you a link. Make sure we have your email address. Well, you got a reminder for this meeting, right?
I did.
Okay, well then you
Yes.
should be getting one for the meeting with Chris.
She didn't have one last week, right?
Oh, no, she did.
Oh, I didn't get a link. Okay. I'll make sure my email's right. But I did get this one, so I don't know.
If you got a link for this meeting, you should definitely get one for Chris's meeting.
I'll make sure I'm signed up. Okay, thank you.
I got one for this meeting and the new patient meeting, but not for the Chris's meeting.
Okay, you shouldn't have got one for the new patient meeting.
Well, I have a
You're
couple
not a new
people.
patient. I mean, you're welcome to join.
I have a couple people I'm encouraging, so I
Okay.
I think I tried to get in on it for info for them.
Mhm. Now that
Thank
meeting is recorded and that's going to be posted, but this meeting for existing patients is more of a private meeting. And you'll be getting a recording, but it's unlisted. It's not going to be on YouTube because I want to maintain, confidentiality for a lot of you that are undergoing treatment.
Thank you.
Yes.
Okay, Mark, how are you, Mark?
Hello.
Yeah, Mark, how are you?
Oh, very good. Thank you. I've been doing the microcurrent and for the eyes and also the syntonic light phototherapy. And I've noticed that over the course of this year, my right eye astigmatism has gotten significantly worse. And I don't understand what drives the level of astigmatism in an eye.
Well, that's something that I've never heard of before. Astigmatism is the shape of the eye. It has nothing to do with the macula or the cataract. It's the shape of the eye.
I thought it had to do with the curvature of the cornea.
Yeah, that's what I mean, the shape of the eye, shape of the
Okay.
cornea.
So I had some external trauma to the cornea like 10 years ago, but why would it all of a sudden now be, I don't know what it's doing.
Possibly, maybe you had some external trauma to the cornea and it was some scar tissue and the microcurrent is changing or healing the scar tissue.
So this could be a positive sign?
Well, I'll tell you what, you said your astigmatism has changed. Can you send me a copy of your eye records so I could see exactly what the astigmatic change is?
Okay.
Because there's good astigmatism and bad astigmatism.
What's the difference?
It depends on the direction.
Oh.
If the astigmatism is located in a certain direction, that can actually help your vision. Some astigmatism, it is at a bad angle. Now, as we get older, because of constant blinking and squeezing our eyes, we tend to get astigmatism in the horizontal axis of our eyes. Babies, newborn babies, when they're born, they usually have astigmatism vertically. As you get older, blinking your eyes, it changes the astigmatism.
So especially at night, I see multiple, like if I'm looking at the stoplight, I'll see multiple stoplights vertically. What does that mean?
That's unlikely that's caused by the astigmatism. That could be another issue.
Huh. Okay.
But remember this, astigmatism is very common. I would say 80–90% of the population has some form of astigmatism. It's not like it's unusual.
I guess I was concerned about the change so much.
Well, I'd like to know, how it's changing. Is it changing for a good astigmatism, bad astigmatism? What's going on? Maybe if you send me your records, I can have some idea as to what's going on. We do have some microcurrent frequencies for astigmatism. I haven't used it in a long time.
Oh, did those surround like inflammation or something like that?
They're frequencies for the shape of the cornea.
Oh, wow. Okay.
But I haven't used them in years because I very rarely see a patient that has a complaint of astigmatism like you do.
I'll get another.
Before I would even consider using them, I want to take a look at your records and see exactly, what's going on with your eye.
Yeah, I'm going back to the doctor Monday. So
now there is a test called corneal topography.
Mm-hmm. Yeah, they've done
And
that
that's
before.
probably the most accurate test for astigmatism. It kind of does a topographic map of your eye. So we can see if like the astigmatism is like the Grand Canyon or the Appalachian Mountains, or, it'll tell me exactly.
Okay. One other thing I noticed is that maybe it's common, but maybe I don't know. So when I wake up in the morning, my both eyes are fairly bloodshot, and then after maybe an hour or so, they clear up. But is that just because when I'm asleep, my eyes are closed and the surface of the eye doesn't get any oxygen?
Well, it could be that you have a chronic inflammation. There's
Oh,
a condition called blepharitis. So when you're sleeping, see, when you're up during the day and you're blinking, your tears are bacteriostatic. They prevent bacteria from growing. When you're sleeping at night, your eyes are closed. And if you do have a minor infection, that bacteria will grow.
so I could use the ozonated drops.
Yeah, maybe the ozonated drops will help. And
Okay.
also make sure that maybe before you go to bed at night, use some warm compresses, gently clean
So
the
I
eye.
run the microcurrent at night, thinking that overnight it would be better for my eyes to heal that way rather than go out
Yeah,
and get sunlight.
that's when I like to do the treatment at night,
Okay. Okay.
because your eyes do heal.
All right. And one last quick question, if I could. I noticed that one of the available programs for the microcurrent is for tinnitus. I didn't get it on my machine, but I was told by a doctor that there's no known cause of it, and I think it's got to be something like inflammation of the middle ear or something like that, right?
I have used, in fact, I'm working with an ear, nose, and throat doctor. We have about 4 or 5 different variations of the ringing in the ear program. But to be honest with you, I haven't had much success
Oh, okay.
in treating tinnitus.
So
But I
people really
am
don't know
working
the
with an
cause.
ear, nose, and throat doctor on trying to find the right frequencies.
Wow, so that sounds complicated. Like it's related to the nerves and who knows
Well, I
what,
think that
right?
there could be it could be a nerve problem. It could be toxicity too, toxins in the body. It could be just circulation.
Well, I
And
know
so hardening of the arteries, ossification of the middle ear.
for me, I noticed when it first started was way back in high school. Someone dropped a cherry bomb in a trash can right behind me, and that nearly knocked me to the floor. But I was deaf for a while, and after that, it's tinnitus for the rest of my life.
Yeah, well, it could be related to shock.
Shock. Wow. Okay. There's a
So
thousand factors involved.
one thing that one program I always like, and I like people to try that first, is the inflammation program.
Okay.
You may be surprised. Just run the inflammation program on your ears, and that could help.
We'll do that.
You have
Okay.
that number 5 on your machine.
All right. Okay, I think that's about all the questions I had for today. Thank you.
Okay, thank you. Thanks for joining the meeting. Okay, question is, where should I place the gloves to reduce inflammation of the sinuses and bronchial tubes? So you may want to watch that video that I mentioned that I made. But the general rule of thumb is you draw a line from one glove, from glove A to glove B, and you want that imaginary line going through the area you want treated. So if you want the sinus treated, I would put one glove on the right side of my face, one on the left, or put a pad. But if the sinuses are just on one side, you might want to put, one here and one there and draw an imaginary line. Does the OCT optic nerve fiber measurement fluctuate? It does fluctuate. I would say there's probably a 10% rate of variation, and that depends on hydration. Remember, the doctors are taking a measurement. They usually take maybe 8 randomized measurements. So it can vary. It can vary within 10%. I will
What's
be able to go-
OCT? What's OCT?
That's ocular coherence tomography. That's a measurement of the thickness of the optic nerve. And that's something that we follow with people that have glaucoma. It's a very accurate test. It's very accurate, but it does have some fluctuation. Generally speaking, I like to see the number above 70 microns. And Jennifer, your numbers are phenomenal. 93, 100, that's exceptional. I don't think the microcurrent will affect the Holter monitor, but you may want to talk to your cardiologist about that, and you may not want to use it when you're doing the Holter monitor. I don't think it will. It's unlikely. Okay, so a lot of you didn't get a link for Chris's meeting. I'll have to make sure that you get it. But if you got the link for this meeting, you should get it for Chris's meeting. If you don't get it, it's automatically sent out on Monday. Okay, Monday at 8 o'clock Eastern time. So if you don't get the link by Monday, let Chris know, and make sure Chris lets me know, because I have to make sure that your email is in the automated program. You may want to check your spam too. It could go to spam. That's what happens too sometimes. Okay, let's see here. We have Joseph Okalita. Joseph, how are you? You have to unmute yourself, Joseph.
I have two questions for you, sir.
Yeah, great.
Number one is that how young a person can enter into your program?
I'm sorry, what was the question?
How young a person can enter into your program?
Oh, that's a good question. I mean, I have taken care of 5 and 6 year olds.
So a 15-year-old would be possible then?
Oh, definitely, definitely. I've treated a lot of congenital eye diseases like Stargardt's, and with the microcurrent, and it's been very, very beneficial. So certainly a 15-year-old. I thought you were referring to maybe a baby.
No. Just that I have my niece is voracious reader, and her eyes have degenerated right now. They've diagnosed her as having myopic maculopathy, where the back of the eye. And they've
Oh my goodness, at a young age like that, boy.
Yeah, she's read literally hundreds of books at this point, and they've outfitted her with these KT lenses, I guess they are. And she's sleeping at night now, and they're doing some other different things to try to keep her eyes from continually elongating at the back. So, but your program could be a benefit to her, it sounds like.
Yeah, definitely, definitely. But there have been some studies that sugar is a big culprit with myopic degeneration.
I'll talk to her mother. I'll talk to her
I would say eliminate sugar from her diet. Cold turkey, no sugar.
Okay, that's a very good point. I'll mention that to her mother. Second question is a good friend of mine, his wife has this hereditary eye condition whereby the optic nerve is slowly dying. I thought he mentioned, I hope I wrote this down correctly, something called OP3 or mitochondrial. Apparently it's hereditary. Her dad, I guess, is now blind herself. Her eyes, again, the optic nerve is sort of slowly dying. I'm not sure if I know the correct name of the disease.
I think I know what you're referring to. There's a Leber's optic atrophy. And I think it's also called something else, but send me a copy of the records. But I know for a fact that microcurrent definitely can help slow the process. We're putting energy into the optic nerve along with ozone light therapy, doing all these things to help preserve what's left of the optic nerve.
Right. And I'll please pass on your name to my friend, and I guess they can contact Chris and get some information perhaps.
Yeah, go to freeconsult.us, all one word, freeconsult.us, send in the records. I'll personally review the records. I won't be able to talk to them, but I give my recommendations to Chris, suggestions, and then she can relay it to him.
Okay, thank you, sir.
Oh, thank you. Jennifer, you have a lot of questions today. Let me click you on. You're able to talk. Jennifer?
Hi, can you hear me?
Yep, I hear you. How are you
Oh.
doing?
I'm doing okay. I've been 2 weeks now doing the microcurrent. I just started working with the eye program, and I was actually trying to use the ringing of the ears program just because that ringing drives me nuts. But then I just started using the inflammation and detox programs. I was kind of starting them one at a time and then trying and then adding because I didn't want to add them all at once.
That's probably a good idea so you don't overwhelm your body.
Yeah, I did it in a transition kind of.
Mhm.
And I was going to try to spread them out during the day so that my body had a chance to process, I guess,
Mhm.
the messages. But I heard you say that it might be better to do the eye one at night before bed because it'll help with healing. It'll give the body a chance to heal since the body heals between 10 p.m. and 2 a.m. And
Yeah, the retina and eye regenerates at night, so it makes sense to me to do the microcurrent before you go to bed. That'll help stimulate the healing process, and then your body rests.
okay. And I tried doing when I started the detox one, I actually wound up sleeping for like 11 hours after. Should I be making sure that I drink a lot more water when I'm doing the detox
Yeah,
protocol?
definitely drink a lot of water. But that's the first
And it
time I've
doesn't
heard of
matter
that.
where.
That's the first time I've heard of that symptom, sleeping for 11 hours after the detox.
Well, it may be unrelated. I don't know, but I fell asleep while doing it and I woke up 11 hours later and I was like, wow.
But how did you feel? Did you
But
feel
I know
refreshed?
from my I felt okay. I don't know if I was refreshed, but I felt okay.
Mhm.
You know, one of the reason why I was asking more questions about the glove placement was just with detox is because when they did my thermography, my European thermography test, it showed that I had a lot of toxicity in the pelvis and in the respiratory tract, you know, my bronchial tubes and in my pelvis. And so, although I know you have a great video on that glove placement, which I have watched now, but I wasn't sure if when with the detox, do you put is it does it do we is it better to just put is it more effective if you just leave it in the mid abdomen, or should I be
Well,
placing it
if you
over
have,
these?
if your study showed you have a lot of toxins in your lung, I would do the lung program first on your lung and then do the detox. The detox essentially addresses the kidney and the liver, organs of detoxification. In other words, it stimulates the body's process of detoxification. So I don't think it's going to be that effective if you would use it like directly over the lungs. So you would do a lung program or a pelvis program and then do the detox.
Oh, I don't think I have a lung or pelvis program.
Well, you could just run the inflammation program on your lung or pelvis.
Okay.
And
And
then
do that after?
then do the detox after on your abdomen, or just holding
Oh, okay.
the gloves in your hand.
Oh, okay. Okay. Yeah, and I had the questions on the optic nerve fiber OCT test was because I saw the eye doctor yesterday. He took a scan again, and I noticed that my numbers were down. they were like at 93 instead of 100. So I didn't know, you know, I have to contact Chris because I'm out of the supplements altogether. So I don't know if she was going to send supplements with this when I enrolled in this program or not, but I have to purchase, if not,
Yeah, I would
more
double,
of the
I would
optic
double,
nerve spray, of the optic nerve formula and the spray.
yeah, I would double check with her.
Okay.
But I would not be too concerned about those numbers because your numbers are excellent. Anything
Okay.
above 90 is exceptional.
I know. I look at directional. That's what I was asking, if it fluctuates, because I'm looking directionally. I want to make sure that while it's still good, that I'm not declining.
Yeah, now, if every time you get it and it drops down 4 or 5 points, then I'd be concerned.
Okay. Yeah.
But it all depends on the technician. It depends on your hydration. It depends on the angle of your eye. There's so many factors.
I see. Okay. Yeah. I won't go back for another 6 months. He checks me every 6 months. So
Yeah.
I'll see what.
Mhm.
Okay. Thank you.
Okay, thank you. Good luck. All right, let's see here. Oh, Tyra. Hello, Tyra. How are you?
I'm well, thank you. I'm just now getting onto this. Thank you. I don't know what the actual format is. Can I just can ask you a question?
Yeah, usually at the beginning, I usually give, an introductory talk and then open it up for questions. So,
Okay, I guess I missed
Uh,
your introductory talk. I'm sorry.
no, but I'll send you a link. I'll send you a link to the whole presentation.
Wonderful. Actually, I have two questions. I don't know if you have time for that, but I have the microcurrent machine. I attended your program some 10 to 12 years ago.
12 years
unfortunately,
ago.
yeah, quite some time ago. And I used it for quite a while, but I still ended up having to have the cataract surgery, and that everything just went downhill from there, from the surgery, all the complications. And then my doctor kind of got me into Dr. Tennant's program. So I kind of started following that, and I quit the microcurrent. Well, I just now, anyhow, long story short, I'm back doing the microcurrent for probably the last 3 or 4 months. But unfortunately, because I have silicone oil in my eye from retinal detachment, it's caused so much damage. And I just now am recovering from 2 retinal detachment surgeries. And I'm wondering if there's something else other than my microcurrent, or if there could be updates on it.
Yeah, well, the first thing, because I haven't talked with you in 12 years, I definitely need to see a copy of your records. That's the first step.
Right. I send all those to Chris. I just don't quite understand how I get the information back from you. Is that just through her, or do I speak with you?
When did you send the records?
She said she had them all this week when I talked to her.
Yeah, well, then she'll be getting them together and sending them to me, and then I'll review them.
Okay, and then you talk with me, or you talk with her?
No, I'll be sending Chris a report, and then she'll give you a call.
Okay.
She'll go over it in detail because I really can't talk to everyone after they send me free records. It'd just be too much.
Right.
I give a report, I review the records, I give a report, make my recommendations. But one thing I would highly recommend is that you join our continued care program. We would reprogram your machine, get you started on new light therapy, a new homeopathic remedy. That's for people who, come back into the program after many years.
Okay, I'm definitely interested in doing that. Then I was unclear as to whether the silicone oil might make it to where there was really nothing you could do, because right now my vision is so very, very limited. I mean,
yeah, I'd have to take a look at your records. I mean, I'm familiar with the use of silicone oil, but the microcurrent can still be effective even if you have silicone oil in the eye.
Oh, good. That makes me very glad to hear that. And could I ask one more quick question?
Yep, you're lucky. This is the last question because we're running out of time.
Oh, okay. You had spoke about always wearing dark glasses if you have the artificial lens, which I do from the cataract surgery. How do you feel about wearing a sun hat and sometimes not wearing sunglasses? And what about the pinhole glasses as sunglasses?
Well, I didn't say dark glasses. I said blue blockers. That's a certain type of lens that prevents the blue light from getting into your eye. Your body needs blue light during the day. You have to avoid blue
Okay.
light at night. And everybody's different when it comes in terms of their sensitivity to the sun. I mean, if you're living in Phoenix, Arizona, the sun can be deadly. You know, you have low humidity, high altitude, and bright sun. But if you're
Okay.
living in Seattle, where, you know, you're at a lower altitude and high humidity, you don't have to worry about ultraviolet light. But we do need ultraviolet light. And my main advice is you want to protect your eyes from blue light at night.
All right.
So that's why they have the blue blockers, and there's a lot of devices. The iPhone and some computers shift from blue light during the day to like a red tone at night.
But as far as going outside then without sunglasses, that would be all right?
Yeah, for a brief period of time, that would be fine. Your body needs ultraviolet light.
Okay.
Okay, but
That's
I have a
good to
really
know.
good podcast all about the dangers of blue light by Professor Abraham Hayam. If you go to
Okay.
Kondrot Podcast, you can search for that. That's a really good podcast.
Thank you so much.
Okay, I want to thank everybody for joining me at the meeting. And once again, Chris will have her ask Chris a question every Wednesday at 2. If you don't get an invite by the end of Monday, let me know, because your email address may not be in the system. Otherwise, I'll be talking to everybody in 2 weeks. Thanks, everybody. Have a good weekend.
Thank
Bye.
you.
Thanks, you too.
Bye.